Okay, started your timer and here is your question.
Done.
Yes, so I'll move on to the next one. You can tell when you're ready.
Okay, I'm ready, ma'am.
All right, so considering this, if you've read and understood, considering this communication skills station, kindly please begin.
Hello, I'm Dr. Mithila. Can I begin?
Hello. Yes, yes.
Hello, I'm Dr. Mithila, ST1. Could I check that I'm speaking to cardiothoracic surgeon, Mr. Mann?
Yes, I'm Mr. Mann speaking. Please present your case.
Thank you, sir. Today I'm calling to ask you to accept a referral of a polytrauma patient with a widening mediastinum. A patient, young patient, diabetic patient of 23 years of age, presented with emergency department. His GCS is 14, heart rate 120 beat per minute, blood pressure 100/80 millimeter of mercury. On examination, temperature is 37 degrees centigrade. His left thigh is swollen, but there is no open wound. On blood investigation shows decreased hemoglobin, raised CRP, and metabolic acidosis. Plain X-ray chest shows widening mediastinum with bilateral pleural effusion. Right-sided chest drain is given. Abdominal X-ray shows obliteration of psoas shadow, and fracture left femur is present. We cannot do the CT scan because our CT scan is being serviced for next 3 hours. I'm sorry for that. Sorry, next 3 days. I'm sorry for that.
Okay. What about the patient's cervical spine?
I will check that and I will let you know. And I will support it with the heart collars and bag and the tape.
Okay, and what would you do for the leg?
As it is an open wound, so I will give the surface traction, usually with the Thomas splint.
Okay, and you say the blood pressure was 100/80. How would you manage that?
We have already gave 4 liters of crystalloid solution and cross-matched 6 units of blood, but we should not let the blood pressure rise for the fear of increased hemorrhage.
Okay. You said the patient's arterial blood gas analysis showed metabolic acidosis?
Yes.
Why is that?
It may be the patient has a closed fracture, so compartment syndrome may be a possible cause. Another cause may be hemorrhagic shock, or as patient is diabetic, so diabetic ketoacidosis may happen.
What is the condition of the patient's abdomen?
As ultrasound, as plain X-ray shows obliteration of psoas shadow, so there may be a fluid collection. I will do a focused sonology of abdomen for trauma and let you know if there is any collection. And I will consult with the general surgeon if there is any need of exploratory laparotomy.
Okay. Which disciplines of surgery are you going to involve here for the management of this patient?
I will involve the trauma surgeon, general surgeon, orthopedic surgeon, and vascular surgeon.
Any other surgeon?
Anesthesiologist and my ITU colleagues.
Any other? Okay. All right.
So do you have any recommendation for this?
Okay. No, so you can refer the patient to me. Is there anything else you would like to tell me about the patient?
Okay, I will come with one of my anesthesia colleague and ITU colleague during the referral, and I will monitor the patient during the procedure.
So, okay. And you're sending the patient to me for?
For widening mediastinum for cardiothoracic evaluation, if there is any intervention needed or not.
Why do you think there? What is the diagnosis for this widened mediastinum?
There may be some pericardial injury or cardiac injury or any pleural or lung injury. We have to evaluate the patient.
All right, doctor. I accept your referral. Okay. Thank you.
Thank you. May I summarize the recommendation for you?
Please go ahead. Yes.
What type of ambulance would you send the patient in?
With ICU support.
Okay. I'm okay.
Yes, who would accompany the patient?
I will accompany the patient with one of my anesthesia colleague and ITU colleague, my trauma team.
If I don't have a bed available for cardiac ICU, what would you do meanwhile for your patient?
I will monitor my patient. I will give primary supportive management, and I will talk to the bed manager to arrange the bed by facilitating any discharge of a patient or anything he can do for this patient.
Okay. Do you think this resuscitation which has been given to the patient is enough?
As his blood pressure is normal, I will monitor the patient. If condition is normal, I think this is enough for me.
Okay, now you can summarize.
Okay, I will assure the cervical collar stabilization. I will give the coma splint for the closed fracture, and I will do fast for the abdominal collection, and I will transfer the patient. I will accompany with my trauma team during the transfer process.
Okay, can you, maybe you have already, can you comment on the ABGs of this patient?
This is a picture of metabolic acidosis.
Okay, how do you think this should be corrected?
Sorry?
How should that be corrected? Metabolic acidosis.
Yeah, I will this is the patient's general assessment, and I will give the IV fluid, oxygen support.
something like that.
What type of shock is the patient in right now? Does this tell
Maybe
you anything?
hemorrhagic shock.
Yes, very good. Not maybe, definitely. A patient
Yes,
can
definitely
even be,
hemorrhagic.
because the patient is diabetic. Here you can read.
Diabetic
Non-diabetic
ketoacidosis.
can also.
So,
That's occurred. Yes.
metabolic acidosis treatment will be depend upon the cause.
Yes, this is what I wanted you to come to. All right, good. Yes. Do you want to give feedback to the candidate, doctor?
Yes, ma'am. So firstly, okay, another good question that Dr. Tanzina asked in this thing. Doctor, if you could, Dr. Mithila, if you could just tell me, I'm a cardiothoracic surgeon. You're referring the patient to a cardiothoracic surgeon and not an orthopedic. Why? Why not an orthopedic surgeon?
Because
What is the urgency?
as there is a mediastinal widening,
Very
so
good.
if there is a cardiac injury, it is an emergency condition. I need to intervene.
So,
further.
And
I was
patient is
actually
undergoing hemorrhagic shock as well.
Undergoing
and
hemorrhagic shock.
yeah. So, I was actually looking for the term cardiac tamponade from
Yes.
you. Like this was the
Yes,
term I was
yes.
looking
Yes,
for.
which
Yeah.
she didn't come up with. Actually, problem is you all have the knowledge. It's just that you do have to practice, because she knew even why patient is having metabolic acidosis, but I had to make her to spit out that yes, why hemorrhagic shock is there, patient is diabetic, and then management will be according to the underlying cause. So you all have the knowledge. It's just that you need practice so that you can come up to the right answer in the given adequate time. Very good. Anything else you want to advise her? She was composed, she was concise, and she was
very
calm.
she went in the correct pace,
Yes,
which
yes.
is a very good
But
which
the
is a very
room for
good way.
improvement is always there. Definitely with this feedback, she'll rock.
Yeah. You said that blood pressure should not be raised, we should ensure that the blood pressure doesn't rise too soon, right?
Yes.
Yes.
Okay, so what is the term that we use for maintaining this blood pressure? Like we always keep a low BP for this. Do you know what this term is called?
I forgot, sorry.
Okay, it's called
Permissive
permissive hypertension.
Permissive hypertension.
Permissive hypertension. Yeah, this is
Thank you.
permissive hypertension. Yeah.
Very good.
So we
Ma'am, I
are
want to
said
add
a clot
two
may be
things.
dislodged.
Yes, please.
The first one is the patient is diabetic, so they
Yes.
can ask about a initial investigation they want to do, that is the RBS.
Yes.
Okay, and another thing is the patient is stable, then we will go for CT scan also. It's one of the recalls from
Yes,
my
but
In
CT
our
scan
hospital,
is out
CT scan is not out of status.
yes, for next 3 days. This
no,
happens
the patient, the examiner will ask if you can do, then what you should do if the patient is stable, then CT scan.
No, already CT scan is for the next 3 days won't be possible. So, and a trauma patient, when they come, the first thing should be CT head, chest, pelvis. That is the, that is how they usually
Yes.
do this thing. CT scan is the mainstay of investigation for a trauma patient back in UK or NHS.
Yes.
First
Yeah, at
CT
the trauma
scan
patient.
or X-ray?
Yeah, X-ray.
First X-ray and then CT scan.
Okay.
Dr.
Yes.
Mithila,
Trauma
whole
series.
trauma
Yes,
team will be accompanying the patient, not just only you. So this
Yes,
also you
yes.
have to keep in your mind. And
Yes.
what kind of ambulance? Now you've understood.
So that would be a blue lighted ambulance,
Yes.
and it
With
will
the
have
cardio.
the equipments for CPR. So
Yes, cardioversion.
So you have to say
equipment.
that.
Yes. So you have to keep this in your mind. Good. Thank you.
Thank you.
Okay, I want to ask Dr. Ulfa Tapu. You are asking
Yes,
that who will you involve is? Could you please give
Yes.
me the names of it
Plastic
again?
Oh, I
surgeon.
was looking for
Yes.
plastic
Plastic
surgeon.
surgeon.
Yes.
Yes. I knew.
I was looking for
Yes.
plastic
Yes.
surgeon.
I knew
Yeah.
she is looking for that answer. Yes. You
Yeah.
always
Why
have to
plastic
keep in your...
surgeon?
Yes. Very good question.
It's a
Tell me.
closed
Because there
fracture.
is there is a closed fracture, yes, but then
Yes.
you're going to go for there is going to be intervention later on given for this
Yes.
patient, right?
Yes.
So then for follow-up, you have to ensure that this patient, you have to follow up with a plastic surgeon too. So yeah.
Good. Good.
In closed
Okay, ma'am. In
fracture,
short,
there is
if they ask what is the management for metabolic acidosis, so in short, can we say that correcting the underlying cause by one sentence, or we have to
No,
do
no,
the
no, 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 no.
secret?
You have to say, since the patient is non-diabetic and patient has
Mhm.
undergone trauma, so there could
Mhm.
be hemorrhagic shock. So after ruling out the underlying cause, we'll manage. So you have to tell the management ruling out the underlying cause, because since
Okay.
patient is diabetic, doesn't have to be diabetic ketoacidosis. Could be
Okay.
hemorrhagic shock. Could be any other
Okay.
underlying reason as well. So you
Okay, ma'am.
can't
Thank
just
you.
jump onto yes. Good.